Welcome, everybody. Welcome to Jay's Corner. It is August 20th, Saturday, 11 a.m. Eastern Time. My name is J.O. I'm the author of Maximize Your Medicare. Many people know that. It's available pretty much everywhere. Up on your screen is the newsletter, free newsletter, jo.substack.com. You can see the address there below my image. There's a free and a paid version here. Be sure to subscribe to it. It's got a lot of other things more than simply Medicare matters. It is the weakness of social media and all of, our video age. You're getting information in segments, putting people in niches. The niches don't really apply here to Jay's Corner. Longtime followers have come to know that maybe you found me from the book. But then after watching the material, after reading the material, watching videos, listening to podcasts, looking at interviews, etc., what you will should conclude, is the fact that Medicare is just a simple example of financial rationale that I'm trying to shed light, give you my insight after traveling around the world, literally around the world, multiple times, to give you, to try to separate the signal from the noise. So much noise around financial topics in general. So I have returned from vacation. And, let's just take a look at here and see if we've got any good examples of what happened on vacation. I'm sure that there is something here. Yeah, let's see it here. So I spent some days doing that and making fun of myself, of course, because that is what I'm all about. No point of taking yourself too seriously. That all said, topics here on Jay's Corner, very serious. Be sure to like and subscribe to the video. Lots of different topics for all age divisions. Okay, we're going to start at the ACA here today. The Inflation Reduction Act passed into law over the past week. Right? The Build Back Better Act was the original starting point. A lot of the stuff not adopted. But the Inflation Reduction Act will absolutely help persons that are enrolling in pre-Medicare individual health insurance. The expanded subsidies, which are tax credits, pull forward tax credits. That's how to understand your lower premiums. That's how to understand why your out-of-pocket maximums can be lower, why your deductibles can be lower depending on the plan that you're selecting. Those subsidies, that entire structure has been extended for 3 years. And you'll see here, the reason I'm pulling back here to this screen here is that, I have been making some points here throughout Substack, throughout the newsletter here, expressing my concern about the fact that if the Inflation Reduction Act wasn't passed, that those subsidies would have ended. That would have dramatically affected the cost of health insurance premium, as well as the lower deductible and out-of-pocket maximums. Those are preserved for 3 years. 3. Now, the reason that this is important, well, let's make it obvious. For every age division, this is still huge. The APTC, which has been called Medicaid expansion in the past, it's not exactly the way that I would have called it. Right? Because what it does is it introduces the stigma of Medicaid. It's not really Medicaid, right? Because Medicaid is for persons who rely on every dollar for food and are living literally check to check. You've got to have your state-specific examination of not only your income, but your financial resources. This is not that. The APTC is not a financial resource-based program. In other words, if you're a corn farmer and you have 100,000 acres, it is very possible to receive health insurance at $0 premium. That can occur. That can occur even if your acre of corn farm, 1 acre is $10,000 an acre. Doesn't matter if you understand what you are actually doing. Now, Jay's Corner, beyond the Maximize Your Medicare channel, there are services that we provide to try to guide you to see whether or not you can get to that spot for those persons. Who else? Everyday person, 28-year-old Mr. or Miss Perfect, right? You are running in a gig economy, let's just say. You're a freelancer. You work as a 1099, which is as an independent contractor, a situation which is very common today. We'll get to at some point, well down the to-do list, not for today, is the fact that, if you're 26 and you're 26 and you can become a TikTok star, I'm going to strongly ask why we're working for a Fortune 50 company at all. Anyway, the fact of the matter is that you can get health insurance at this lower price. In other videos, we've got examples of how to use the healthcare.gov website and figure out whether or not you get your subsidy. The enrollment period's coming up. We'll have time for that in future months. Bottom line here for you is the fact that the Inflation Reduction Act tax credits improve coverage affordability for middle-income Americans. That is accurately stated. Accurately stated. So, 2 things to take away. Number 1, remember that this is an income-based, your current income. You do need to handle that with care, right? You can't give a knowingly incorrect estimate to push down your health insurance premium, because when you reconcile your income taxes, that gets discovered. And if wildly off base, you probably don't want to deal with the ripple effects, because that can mean that the IRS will be knocking with a little bit more force than simply you've underpaid. The second one is that this does change the entire retirement timeline for some of you. I've made examples in the past. If you are 62, 63 years old, married couple in Florida, for example, Texas, Arizona, you know who you are. I'm choosing you individually and specifically. Why? Because you live in very high cost states, even more so than the average. That what can happen here is, because of this extension, it is then therefore possible to look through this timeline here for you, and you're now 62, and now all of a sudden this orange line here on this screen, it's a screen that I've used for examples sake in the past, which is now all of a sudden, as you're considering your budget on a month-to-month basis, now all of a sudden this orange line can be dramatically reduced. You should not underestimate the impact here, because this number DDDD here in orange that you can see on your screen, in Florida, this is a $900 a month per person line item. You're 62. $900 is the full sticker price. If you drive that down to $200, $700 per person per month, you can do the math. It's enormous. And now you can understand the link to financial topics, the other financial planning matters here on Jay's Corner, which is that Medicare then is your place as you're trying to drive down this orange line through time, especially under retirement when you're trying to manage all the other moving parts of retirement planning. It also matters for the 28-year-olds. You can remember if you're Mr. Perfect, you're 28-year-old, I can tell you how many times you go to the doctor. 0. So the idea that, okay, well, I have insurance doesn't pay anything, and that's your complaint, which is one that you'll be able to just go to a bar for an hour. I promise you that that statement gets made by somebody in that bar. The fact of the matter is that may have been the totally rational selection by Mr. Perfect, because he has other things to do with that money as opposed to spending it on health insurance premium. For those persons who are on retirement planning track and thinking about retirement, in addition to, understanding what happens in my book, right, which is Medicare, the fact of the matter is that the real link here is to drive down this number prior to Medicare as well. And as I said, the financial impact is not $50 a year. Just isn't. It's thousands of dollars a year to the year for those years prior to becoming Medicare eligible. Last kind of sub-point is that this is a tax matter. Don't forget this is a tax matter. That also has other ripple effects on all of these other line items, because you can see it there in the left-hand column. Pension, individual account, qualified funds, annuity, and cash. They're all taxed at slightly different levels. Social Security, for example, all taxed at different levels. The ripple effect is down to this orange line, which will also include Medicare, since there's something called IRMA. A topic I've covered many, many times in the national media. Anyway, back to the ACA. No question about it. No question about it. A huge win to extend this for the 3 years. So now you're 62, considering retirement, or you're 65 and your spouse is 62. Now you have an additional extension to lower your health insurance premium, a huge cost input.